This medication is used to temporarily treat cough, stuffy nose, body aches, and other symptoms caused by the common cold, flu, or other breathing illnesses such as sinusitis or bronchitis. The cough suppressant in this medication reduces the urge to cough, while the decongestants help to relieve stuffy nose symptoms. It also contains acetaminophen, a pain reliever and fever reducer. It's important to note that this medication is usually not used for ongoing coughs from smoking, asthma, or other long-term breathing problems, unless directed by your doctor. Additionally, it's not recommended for children younger than 6 years old, and some forms of this medication are not recommended for children younger than 12 years old. Always consult with your doctor or pharmacist for the best and safest way to use this product. Remember, this medication does not cure or shorten the length of the common cold, and it's important to carefully follow all dosage directions to decrease the risk of serious side effects. And it's also important not to give this product to make a child sleepy, and to avoid giving other cough and cold medications that might contain the same or similar ingredients. Be sure to ask your doctor or pharmacist about other ways to relieve cough and cold symptoms, such as staying hydrated and using a humidifier or saline nose drops/spray. If you're taking the over-the-counter product, make sure to read all the directions on the product package before taking this medication. If you have any questions, consult your pharmacist. You can take this medication by mouth with or without food, as directed by your doctor. It can also be taken with food or milk if it upsets your stomach. If you're using a liquid form, be sure to carefully measure your prescribed dose using a medication measuring device or spoon. Don't use a household spoon because you may not get the correct dose. If your liquid form is a suspension, shake the bottle well before each dose. If you're taking the chewable form, be sure to chew it thoroughly before swallowing. The dosage of this medication is based on your age. Do not increase your dose or take it more often than directed without your doctor's approval. Misusing this medication may result in serious harm. If your condition lasts for more than 1 week, gets worse, or occurs with a headache that doesn't go away, a rash, or a fever lasting more than 3 days, be sure to tell your doctor. These may be symptoms of a serious medical problem and should be checked by a doctor. Some common side effects of cold multi-symptom include dizziness, drowsiness, headache, nausea, nervousness, or trouble sleeping. If any of these effects persist or worsen, it's important to contact your doctor or pharmacist promptly. If your doctor has prescribed this medication for you, they have determined that the benefits outweigh the potential risks of side effects. Many people who use this medication do not experience serious side effects. However, it's important to notify your doctor immediately if you experience any serious side effects, such as changes in mental or mood, shaking, weakness, or difficulty urinating. In rare cases, a serious allergic reaction to this drug may occur. If you notice symptoms of a serious allergic reaction, such as rash, swelling, severe dizziness, or difficulty breathing, seek medical help immediately. This is not a complete list of possible side effects, so be sure to contact your doctor or pharmacist if you experience any other effects not mentioned here. If you are in the US, you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Acetaminophen is one of the ingredients in cold multi-symptom. It's important to be cautious with the amount you take, as too much acetaminophen can cause serious liver disease. Adults should not take more than 4,000 milligrams, 4 grams, of acetaminophen a day, and those with liver problems or children should take less. Make sure to ask your doctor or pharmacist for guidance on the safe amount to take. Do not use cold multi-symptom with any other medication containing acetaminophen without consulting your doctor or pharmacist first. Acetaminophen can be found in many non-prescription and prescription medications, so it's crucial to check the labels of all your medicines to see if they contain acetaminophen. If you're uncertain, ask your pharmacist for clarification. If you accidentally take too much acetaminophen, seek medical help immediately, even if you feel fine. Symptoms of an overdose can include nausea, vomiting, loss of appetite, sweating, stomach/abdominal pain, extreme tiredness, yellowing of the eyes/skin, and dark urine. It's important to note that daily alcohol use, especially when combined with acetaminophen, can cause liver damage. It's best to avoid alcohol while taking cold multi-symptom. Before taking this medication, it's important to talk to your doctor or pharmacist about any allergies you may have. This product may contain inactive ingredients that could cause allergic reactions. It's also important to discuss your medical history, especially if you have breathing problems, diabetes, heart issues, or liver disease. This medication may also cause dizziness or drowsiness, so it's important to avoid alcohol and marijuana while taking it. If you're diabetic, have liver disease, or need to limit sugar or alcohol in your diet, be cautious when using the liquid or chewable forms of this product. Before having surgery, make sure to inform your doctor about all the medications you are using. If you're an older adult, you may be more sensitive to the side effects of this drug. And if you're pregnant or breastfeeding, be sure to discuss the risks and benefits with your doctor before using this medication. It's important to be aware of potential drug interactions when taking cold multi-symptom. Certain medications can change how this drug works or increase the risk of serious side effects. Always keep a list of all the products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Avoid taking certain MAO inhibitors with this medication, as it may cause a serious and possibly fatal drug interaction. Your doctor can advise you on when to start or stop taking this medication in relation to MAO inhibitors. Also, be cautious of products that may interact with cold multi-symptom, such as ketoconazole and rolapitant. Always check the labels on your medications to ensure you are not taking more than one product with the same ingredients. Furthermore, be sure to inform your doctor or pharmacist if you are taking any other products that may cause drowsiness, as this medication may also cause drowsiness. This drug may also interfere with certain urine lab tests, so it's important to inform lab personnel and all your doctors that you are using this medication. If you suspect an overdose and the person is experiencing severe symptoms like passing out or difficulty breathing, call 911 immediately. Otherwise, contact a poison control center right away. In the US, you can call 1-800-222-1222 for your local poison control center. Canadian residents can call their provincial poison control center. Symptoms of an overdose may include nausea, vomiting, loss of appetite, sweating, stomach or abdominal pain, extreme fatigue, yellowing of the eyes or skin, dark urine, agitation, confusion, hallucinations, and seizures. If you or someone you know shows these symptoms after taking cold multi-symptom, seek medical help immediately. Make sure to keep all your scheduled medical and lab appointments to monitor your health and the effectiveness of the cold multi-symptom medication. This will help your healthcare provider to make any necessary adjustments to your treatment plan. If your doctor has instructed you to take cold multi-symptom medication regularly and you happen to miss a dose, take it as soon as you remember. If it's close to the time for your next dose, just skip the missed dose and take the next one at your regular time. Do not take a double dose to make up for the missed one. When it comes to storing cold multi-symptom medication, it's important to follow the instructions on the package label. Make sure to keep it away from light and moisture, and avoid storing it in the bathroom. If you have any questions about how to store this medication, be sure to ask your pharmacist. And always remember to keep all medications out of reach of children and pets. When it comes to discarding this product, do not flush it down the toilet or pour it into a drain unless instructed to do so. It's important to properly dispose of this medication when it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for the best way to discard it. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.